Nclex style questions about stroke. Today, guys, I have a few questions about stroke. Hello, everyone. My name is Nurse Kado. So we're gonna practice together. Okay, let's go. Are you ready?
Here are a few Nclex-style questions about stroke, each with a rationale. 1. A patient arrives at the emergency department with right-sided weakness and slurred speech that started 45 minutes ago. What is the priority nursing action? A. Prepare the patient for a CT scan. B. Administer aspirin 325 milligrams orally. C. Perform a complete neurological assessment. D. Place the patient in Trendelenburg position. Correct answer. A. Prepare the patient for a CT scan. Rationale. A CT scan is essential to differentiate between ischemic and hemorrhagic stroke. Treatment differs significantly between the two. Time is critical for administering TPA in ischemic strokes, and a CT scan must be done before any treatment. 2. A nurse is caring for a patient who had a left-sided ischemic stroke. Which of the following findings would the nurse expect? A. Right-sided hemiplegia and aphasia. B. Left-sided neglect and visual spatial deficits. C. Impulsive behavior and denial of deficits. D. Right-sided facial droop and agnosia. Correct answer. A. Right-sided hemiplegia and aphasia. Rationale. A left-sided brain stroke typically results in right-sided motor deficits and language impairment such as aphasia, due to involvement of the dominant hemisphere. 3. A patient with a history of atrial fibrillation is at increased risk for which type of stroke? A. Hemorrhagic stroke. B. Lacunar stroke. C. Thrombotic stroke. D. Embolic stroke. Correct answer. D. Embolic stroke. Rationale. Atrial fibrillation increases the risk of clot F formation in the atria, which can embolize to the cerebral circulation, leading to an embolic stroke. 4. When preparing to administer tissue plasminogen activator, TPA, for a patient with an ischemic stroke, what is a contraindication the nurse should assess for? A. History of hypertension. B. Age over 75. C. Onset of symptoms greater than 4.5 hours ago. D. Facial droop and hemiparesis. Correct answer. C. Onset of symptoms greater than 4.5 hours ago. Rationale. TPA must be administered within 3 to 4.5 hours of symptom onset. Delayed administration increases the risk of bleeding complications. 5. A nurse is teaching the family of a stroke patient about dysphagia. Which action by the family